Sonia Melendez has not been able to see a cardiologist for her heart problems because it's more than a 4-hour round-trip drive from her home in Palmdale, California, to Burbank, California, where cardiologist Dr. Roger Ahn practices. Now, that's all changed, thanks to a groundbreaking telemedicine program in cardiology.
Nunca me han diagnosticado nada que yo padezca del corazón. Hasta ahora que he sentido esos pálpitos diferentes. Me imagino que es para bien para mí.
This unique program, developed by cardiologist Dr. Roger Ahn at Regal Lakeside Medical Group, part of the Heritage Provider Network family, gives Sonia the experience of seeing her primary care doctor and at the same time consult with Dr. Ahn in Burbank. The exam is live, in real time, giving both doctors the opportunity to check Sonia's heart using a live Bluetooth stethoscope, giving them the ability to make a timely diagnosis.
There's also a leftward axis, as you can see, too, which may also be due to conduction system problems.
And since Sonia doesn't speak or understand English, her provider at Sierra Medical Group, also part of the HPN family, makes sure a translator is available to help her navigate the telemedicine appointment.
Nobody ever told her in the past that she's had a heart attack, right? Nope.
Guess what? We made a new diagnosis for her, which puts her in a different category because we have to be much more aggressive at treating her risk now, right, compared to somebody who hasn't had a vascular event.
Gwen Allen and her family are also participating in the cardiology telemedicine program for the first time. Her age and frail condition make it nearly impossible to travel to see Dr. Ahn. But now they're able to learn more about life-saving heart problems and go over her medications.
We're hoping that, we can get some more information as to what's going on with her because of her declining health.
I was tired of being sick and tired. Thought maybe they could help me.
One of the heritage provider groups was struggling as far as number of hospitalizations and as far as the costs for cardiology care in that clinic. The administrative people at Heritage decided that we would establish this program to see if we could fix this problem. What they found after between 1 to 2 years is that, number one, cardiac admissions went down by 50%, and the total cost from the clinic for cardiac issues also went down 50%. It's unique in that most of the telemedicine that's done is either not live, it's not done with examinations, especially with a stethoscope, and it's not done with family members present, usually to try and teach the family as well as the patient their disease processes so that they can become more compliant.
Millions of patients like Gwen, Sonia, and their families are taking advantage of telemedicine programs all over the country. According to Modern Healthcare, use of telemedicine nationwide has increased 53% from 2016 to 2017, giving patients opportunities to gain insight in their medical issues, providing better quality, less expensive health care.
There's actually a disparity on the quality of care and the outcomes of patients depending on location. So different areas lack the number of providers that can take care of patients, and also they do not have the up-to-date type of equipment to help make diagnosis, and they're unaware yet of some of the newer treatments which, when you're in the larger city, you get exposed to on a daily basis. What we found after a number of months is that there is improved outcomes at the remote clinic.
As a result of Dr. Ahn's unique program that has not been duplicated in the rest of the country in cardiology, the American College of Cardiology Innovation Division is interested in exploring a partnership with Dr. Ahn.
When I went to the American College of Cardiology meetings and I met the innovation chairman, he said, I haven't heard of other people doing that. And that's why he invited us to come and try to disseminate this type of information.
Having the direct physical exam where the specialist can literally hear the same thing that the physician that's in the facility is hearing and get that diagnosis more rapidly and accurately affects the quality of care that they have.
I think this is the wave of the future, to do virtual visits like this. And the patients have frequently said they've never had an experience like this before. They've learned more in this one session than they did in the last 10 years about their own health. And on the other hand, it also teaches the providers at the remote location the best ways to take care of their other patients that they see every day.